Good evening, everyone, and thank you for joining us tonight. Before we get started, I'd like to read this brief disclaimer that you see on your screen. The PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I'd like to say hello and welcome and thanks for joining us tonight. My name is Craig Orapello, and I'll be your host tonight. This is the PharmAssist virtual learning experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home. PharmAssist takes place every Monday night at 7 p.m. Eastern Standard, just like this. And tonight we will be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. So we hope you brought your questions, and we hope you're ready to share them with all of us so that we can all learn together. We are joined by various amazing HCPs each week from across the nation to provide you with a real-world experience, just as if you were sitting across the table from them in their own clinic. And typically you can join just as you may have tonight via Zoom or Facebook Live. And we invite you to be a part of the discussion by sharing your questions in either one of the formats. You can put your questions right into the Q&A or chat if you're joining us via Zoom. And on Facebook, you can type it right into the chat right there. So tonight we are joined by Laurel Meier, and I want to say thank you so much, Laurel, for your time and interest and your expertise for tonight. Thank you, everybody, for your interest in joining us. And now I want to turn it over to Laurel. Take it away, Laurel.
Okay, thanks, Craig. My name is Laurel Meier, and I'm an IVF case manager in California. I've been doing this for about 15 years now. And tonight we're going to be reviewing 3 products: the Gonalef multi-dose vial, the Menopure, and the Cinera patch. After every video showing you how to use these medications, there'll be a Q&A session at the back end. So I encourage you to write all your questions in, just type them in. Any question you have, someone else is going to really benefit from it too. So please focus your questions on how to use the medication, the side effects, how it's, what happens, why it's used in the body. And please focus your questions for your specific dosing and timing back to your clinic. So once this is done, you will be able to access this video and all other videos through the mymandelsPharmacy.com website. They're always accessible for you at any time. So I'd like to start by telling you about how I got interested in becoming an IVF case manager. About 25 years ago, my husband and I started having problems getting pregnant. So we first turned to using Clomid, which maybe some of you have used, and we tried that a few times and it didn't work. So we moved on to IVF, and we did 2 cycles of IVF, and unfortunately, those 2 cycles didn't work. Now, while we were still pretty upset and reeling from the bad news of the IVF cycle not working, we got a call from a very dear friend of ours that was a labor and delivery nurse. And she had a patient, a woman who had just delivered her baby, and she wanted to find parents for her baby. So my friend told her about my husband and I, and she wanted to meet us. So the next day we went down to the hospital and we met her and her baby. And after a lengthy discussion, she decided she wanted us to be her baby's parents. So we brought our baby girl home the next day, and it just happened to be Valentine's Day. So that was quite a blessing. Then about 3 years later, we wanted to have another child, and we decided to go forward with a frozen embryo transfer cycle with an adopted embryo. I was able to get pregnant. I carried this baby, a baby girl, our second baby girl, to a full-term delivery, and she was born on 4th of July. So now these 2 girls are 16 and 20, and here's a picture of them. Not sure you can see them very well. There we go. There they are. That's Megan on this side, Sydney on the other side, and they're amazing, and it's been quite a journey. So the reason I tell my story is because I know how hard this process is, and I hope that hearing my story makes it just a little bit easier for you. Know that you're not alone. There's thousands of people, couples going through the infertility just like you are. And I encourage you to reach out to family, friends, and other people going through infertility for their support. It's really, really helpful just to reach out and talk to people about what you're going through. So this is why I became an IVF case manager and why I decided to give my time and energy to the My Mandel's PharmAssist program. It's a wonderful program and I'm proud to be a part of it. So tonight, my goal is to help you gain the strength and confidence to give yourself your own shots. And I know that it'll feel intimidating at first, but you will feel like a pro very soon. So Craig, now we can, when you're ready, we can start the first video. It's going to be on the Gonal-F multidose vial. Hi, my name is Laurel, and today I'm going to demonstrate the Gonal-F multidose vial. This is utilized for more than one shot, and you'll have everything you need for multiple shots in this one box. To start, what you're going to do is gather your supplies. You're going to have your powder. So we're going to use a little bit of imagination and imagine that there's a little disc of powder in here. You've got your pre-filled, your water, your sterile water, and you've got your syringe that you're going to draw it up with. So the first thing you're going to do is pop off the cap, and you're going to take an alcohol wipe, and you always want to alcohol the top of the vial before you do any mixing or drawing up. You're going to take the cap off of your sterile water, put it right in the middle, and put all of the water into the vial. And you're going to notice that there's a lot of pressure that builds up in there because you've just added a lot of water, a lot of pressure to this so that your syringe will go back up, and that's perfectly fine. This is all done now, and you put it straight in your sharps container without recapping. Then you're going to slowly just swirl this a little bit, make sure it's completely mixed, and you can put it up and down a couple times. You just don't want to shake it vigorously because that's going to create some air bubbles. Now you're going to take your needle and syringe. This already has a needle on it. So what you're going to do is find your dosage on the edge here. I'm going to use 300 because that's a common dosage. You're going to put 300 milliliters or units of air in there. And since I just alcoholed the top of that, I'm not going to do it again. Put the needle in the middle, push the air in, and then without taking the needle out, just invert the whole thing. Pull back till you have your dose. I'm going to use 300, as I said. If you have a large air bubble at the top, you can push it out and draw back again. And then push to the 300 line. Once you're at 300, you're going to reinvert and take it out. Now to give the shot, you're going to pick a spot on your abdomen. It can be anywhere where you can pinch the fatty tissue, but stay at about an inch away from the belly button at least. Pinch your abdomen. Go in at a 90-degree angle, like a dart. Let go of the pinch and inject. Have a Kleenex handy so that after waiting about 3 seconds, you can pull out quickly and hold the Kleenex against your skin. Now, in about 3 seconds, you check your skin. If it's dry, you're done. If you see medicine leaking out or if you're bleeding a little, it's okay. Just keep holding until it's dry. Now, this is going to go in the sharps container, and this vial still has lots of medicine left. So you're going to want to put this in the refrigerator for your next shot. And that's all there is to it. Okay, any questions come in, Craig?
Yeah, hi, how's it going? All right, so this
Hi.
question just came in. It says, so let's see, what is the purpose of Gonalef versus just using something like Menopur?
Good question. Okay, so Menopur is a combination of an FSH and an LH, both hormones. FSH stands for follicle stimulating hormone, LH stands for luteinizing hormone. And this is also a very important medication that's typically given with IVF. Now, Gonalef is only follicle stimulating hormone. So typically, a protocol has both Gonalef and Menopur, but you typically will use more of the Gonalef than you would need for the Menopur. Hopefully that answered that. Any other questions?
No, no problem. Sorry about that. It was trying to get it off mute in time to answer. So perfect. Thank you. Yeah, and it's a perfect time to remind everyone that one of the big things about this program, what we try to do is we want to make sure that we're talking kind of more in the generalities of the products, the utilizations, how you utilize them, how you inject them, things like that, and get away a little bit more from the specifics of, why did my physician use this product over that product? Because there's choices, right? And physicians, nurses, your clinic are going to make those choices for you. But the great thing, that was a great way to answer just kind of what is the difference between those two products. And we will obviously get into that a little bit more coming as we move forward with our next product. So that's great. Thank you very much, and keep them coming, everybody. So this one comes in, and this is probably one of the biggest ones you get even when you're sitting down and talking with your patients, getting them prepared for that first shot. What side effects should I expect with this injection? Any tips on how to prevent or treat them?
Okay, so because Gonalef is FSH, the purpose of it is to stimulate the follicles to grow and to produce eggs. And that means the ovaries are going to get swollen. So with swollen ovaries, it's very typical to feel bloated. You're going to want to wear your loose pants. You're going to feel a little bit of bloated. You're going to feel a little bit of moodiness. And increased vaginal discharge happens because of the estrogen that your ovaries produce. So don't be surprised by that. At the site, you could have a little bit of bruising and tenderness. When you give the injection, it could hurt a little bit. But if you have any serious side effects, and there are risks of having ovarian hyperstimulation syndrome, and that would be things like having a lot of nausea and vomiting, shortness of breath. You could also have a lot of pain, a lot of abdominal pain, and severe bloating. If any of those things happen, you're going to want to call your clinic right away. But the things I mentioned in the beginning are all really common and not to be concerned about.
Perfect. All right. Sounds good. Thank you so much. And part of, as you mentioned before, one of our biggest priorities with this whole program is to allow people this kind of open forum to ask these questions now, so that when it comes to the time where you're about to give that first shot, you've already gone through everything. You've already asked all those questions. You've gotten the answers to them. You feel confident and comfortable. You're going to be a pro at this. So that's why we love those types of questions, because we want you to be prepared and know what you're about to get into. And speaking of being prepared, this is probably one that we get, I know, on the pharmacy side all the time. And so I imagine it probably comes up quite a bit for you as well, especially because this is a multi-dose. So patients are going to give, multiple shots from the same vial. The question that comes in, it says, how do I handle injections where there isn't enough left in the vial for a complete shot? Should I use 2 shots in the same night? Do I mix 2 vials for 1 shot? Do I add the difference on to my next shot, etc.? I just want to know what I'm supposed to do.
Yeah, that can cause a lot of confusion. So if you're using your multi-dose vial and you pull up in the syringe and you get everything you can out of that vial, and it's not enough for a full dose, what you're going to do is you're just going to recap it set it down. You're going to mix another box of the multi-dose vial, another vial with, just mix a whole one up. And then you're going to take that new vial and you're going to pull the rest of your dose from that new one. Put that leftover in the refrigerator for the next shot.
Perfect. Thank you. And I know, that's the easiest way to answer it. And that's great, and really make people feel comfortable and confident when you're getting ready, because the last thing you want is you pull out your needle and you are not sure how to handle this night's, this shot different than another one. So it is very easy. It is very simple. And that's what we're here for. And this is a perfect time to remind everyone too, as you mentioned, because all of our things are on demand, because you can find these at right at the point where you're about to give the shot. You don't have to just watch them, tonight on Monday. You can also have it queued up and be ready to go right before you have that needle and you're ready to give that shot. Pull it out, watch the little walkthrough so that you can make sure you feel comfortable and confident on what you need to do right there. Watch it with your, with your partner or with somebody who's going to be helping you to give the shot, or by yourself so that you can feel comfortable. So
right. And every video is separate, so you don't have to watch a whole program like this one. You can just go and queue up just the Gonal-F multi-dose vial or just Menopur and watch that right before you give the shot.
Perfect.
Very convenient.
Absolutely.
Right at MyMandel'sPharmacy.com.
Nailed it. All right. Look at that branding. I love it. Thank you very much. All right, Laurel. So one more question that came in right now. It just says, so this is a little bit different. It's something that we deal with a lot on the pharmacy side, but I'm sure, on the nursing side, these questions come up, and it's about the financial end of things and how people can figure out how to make these medications as affordable as possible. And so the question that came in, it says, I've heard that Serono offers a military program alongside some other potential discounts, potentially things like compassionate care. How do I find out if there are any other discounts that I can qualify for this product?
Good question. Okay, so Gonal-F is a medication that you can apply for compassionate care. And there are military discounts as well, as Craig mentioned. And Mandel's Pharmacy is excellent at walking you through the processes of anything that you could apply for that's currently available. So just ask when you give them a call when you're filling your medication prescription.
Thank you so much. Yeah, perfect. That's what we're here for. And we do like to say that part of the treatment is the triumvirate between you as the patient, obviously your nurse and your healthcare professionals, and us at the pharmacy. And the three of us come together to make sure that we can provide the best possible care and the best possible treatment for you. So yes, when it comes to the financial side, we are more than happy to make sure that you will qualify for any programs that you can, and to make sure that we can, keep the money so you can use it for as many treatments as you feel you'd like to pursue. So thank you.
Yeah, I'd like to also mention that if you have look into your insurance, and if you have insurance that they don't take care of, they will send your prescription to a pharmacy that does. So they're not into it. They want to save you as much money as possible, and they will give you the best deal that they can.
Absolutely. That's very true. Absolutely. That is our goal, is to make sure that you get the best care and the best treatment, but also obviously from a financial standpoint, the best price that you possibly can. So thank you so much, Laurel, for mentioning that. I appreciate it. And with that being said, we are right now caught up on all the questions. Okay. So I always know sometimes people, you just heard the question about finances and maybe it made you think of a question and you're trying to furiously type it in there and get it in before we move on. Don't worry, we will have time at the end to talk about all the different products that we're speaking of today. But we are going to give another 30 seconds or so for people to type in those questions. I will throw it back over to you, Laurel, in the meantime.
Okay. All right. So nothing else to say really about the Gonal-F multi-dose, but if you have questions about it, I really encourage you to type those in and we'll definitely handle them at the end. The next program, the next medication that we're going to go over is Menopur. And we're going to, Menopur, as I said, is a combination of FSH and LH, or luteinizing hormone. It's a very common IVF medication. It's also given for IUI cycles where someone is going to do an intrauterine insemination. So if you're ready, you can cue up that next video, Craig. Hi, my name is Laurel, and today I'm going to demonstrate how to mix and give the Menopur. Menopur comes in little powders, and we're going to use our imagination and we're going to pretend that there's little white discs of powders in these vials. You'll also need a container of saline, a Q-cap, which is a needleless mixing device, a 3 ml syringe, and a small needle for giving. So make sure you have all your supplies ready. And the first thing you're going to do is take the caps off of your supplies. Now, some clinics are going to order for you 1 vial of Menopur. Others will give you 2 or 3. So just follow your clinic's instructions on how many vials of Menopur. Each vial is 75 units of medication. So if you're told to give 150 units, that would be 2 powders. You're always going to be able to mix this Menopur and give it as 1 shot. So the next thing we're going to do is to peel that off. The Q-cap will go directly on the liquid. Just pop it on and take the plastic covering off so it looks like this. Then you're going to take your 3 ml syringe and you're going to put 1 milliliter of air in the syringe, and you're going to twist it onto the Q-cap. Now, keeping it on a hard surface, you're going to push the air in and invert it. Draw up 1 milliliter of the liquid. So you go a little past the 1 and you push the air out until you're right on 1. Pull off your liquid and put it to the side. Now we're going to pretend to mix the powder. So here's the first powder. You push the Q-cap on, you inject the liquid into the powder, and you swirl it very gently. This powder will instantly dissolve. Now, if you have a second powder that you need to dissolve, you're going to push the air in while it's inverted, pull everything back into the syringe, take the empty vial off, put it to the side, and then do the same thing with the second powder. Push it on, inject this into the powder. It will dissolve immediately. Swirl a little, turn it upside down, push, and pull all the liquid back into your syringe. Now, when you're done with all of the powders that you've been told to inject, you're going to twist everything off while you're still pointing your syringe at the ceiling. And you're going to take your small needle and you're going to add the needle. The needle goes on like this. Twist it on, pull the cap straight off. And now it's time to get rid of that air. So just push until you see a drip of liquid at the tip. And you're ready to give your shot. So this is given in the abdomen. Pick a spot, stay an inch away from the belly button. Don't inject into a spot that has a bruise from a previous shot. Anywhere you can pinch some fatty tissue, just give it a pinch, inject straight in at a 90-degree angle, let go of the pinch, inject your medication, wait 3 seconds, grab a Kleenex, pull out, and hold with the Kleenex. After about 10 seconds, check your skin site. If it's dry, no bleeding, you're done. If it's bleeding a little medicine's leaking out, just keep holding it until it's dry. Everything goes in a Sharps container, and your next shot, you're going to get a whole new supply. That's all there is to it.
All right. So any questions come in on that video, Craig?
Yes. All right. So one of the more basic questions that typically come in, and this is one of my favorites because it's not just about the injection itself, but it's about the medication. It's just very basic. It says, how does Menopur work? Why am I using Menopur instead of an FSH like Gonal-f alone?
Okay. So Menopur is a combination medication. It's got FSH and LH in it. And they have done studies that have shown that when you give FSH with LH, these studies have shown that you have higher live birth rates. So this is just the gold standard. FSH is given with Menopur. So you're going to probably have both with your cycle.
But please just, follow your guidance of your clinic on what to take. Everyone's a little bit different.
Perfect. Thank you. Yeah, and there's a bunch of different things out there, so it's great for people to ask these types of questions to really understand, why they're taking something is just as important as how to take it. And so that's really what all of the pharmacist program started about, was to allow people to really understand and ask those questions and get them out of the way, beforehand, so that you don't just feel like you're, just injecting yourself and not really knowing why and what the different products are for. So thank you so much, Laurel. That was an excellent answer. I appreciate it. So you talked a little bit about the mixing process and the Q caps and all that as you were going through the process in the video. And the question just came in that says, how do you recommend, or do you recommend using the Q cap, or is it easier to just use the needle and mix it that way?
Okay, so the Q cap is a needleless system. It is the easiest and safest way to mix Menopur. However, if you feel strongly and you want to use a needle instead, I would recommend getting a different needle to do the mixing and save the little 1/2-inch needle that you have for giving. You don't want to use that needle for mixing. Going through those rubber plungers, every time you do that, it's going to dull the needle a little bit. And then when you give the shot with that little 1/2-inch needle after using it to mix, it's going to hurt a little bit more. So my recommendation is use the Q cap. If you want to use a needle, talk to your clinic about that.
Perfect. Sounds good. Thank you. Yeah, and I know sometimes it can be just the different products having different methods and so forth, and different types of needles and a needleless system. Sometimes people just want to understand why one versus the other, but that really kind of encapsulates it and makes it as easy as possible for people to know why the product is set up the way it is. So thank you again, Laurel. So this one is a little bit, when you were talking about the mixing, in terms of the mixing of the liquid to dilute the product, and this question it comes in periodically, because I think a lot of times nowadays people share information on the internet. They find things as talking through blogs or with friends, and it's a great system that people have this availability to find out from the internet as a whole. But this question that comes up says, how do I decide how much liquid to mix? Does the amount of liquid change the efficacy or side effects associated with the product?
Okay, so 1 milliliter is standard for mixing a subcutaneous shot. Our clinic says you can use 1 milliliter of the liquid to mix up to 4 vials of the Menopur. If you wanted to use more, you could go up to 2 milliliters of liquid to mix your Menopur, but I don't recommend it because it's probably just going to hurt more. If you're giving only 1 milliliter, only 1 vial of the Menopur, then if you would like to try to just use 1/2 of a milliliter to mix that 1 vial, you can. That is not a problem. You may find it stings a little bit more because it's a more concentrated medication. But the main way to diminish or eliminate the pain, the sting of giving Menopur, and it does sting. It's one of those medications that hurts more than the other ones. So one of the things that you can do is ice your skin ahead of time for about a minute. And the main way to keep this medication from hurting is to give it as slowly as you can. So as you're giving it, if it's hurting, just slow your roll, like just slow it down, and it will really help you not experience that pain.
I love that you said slow your roll. That's perfect. The best answer ever. Awesome. Thank you very much. All right. And so I think, again, this is kind of just in the presentation of the medication. Sometimes we often recommend that when your medication gets there and your package gets to you, don't wait right until that last minute to pop it open and start looking at what's in there. You want to make sure that you have everything, just like when you get anything from Amazon, you go through your package, make sure everything's there. But also you want to just kind of get familiar with it, so the first time you're seeing it isn't right before the shot. And that is what leads me to this next question that came in that says, sometimes my Menopur looks like a powder. Other times it looks more like a solid pill or a tablet. I know that you'd mentioned kind of like the way it could show up is fine, but does it impact the quality of the shot? Is there anything I should be worried about here?
Okay, well, it typically looks like this. It's a little tablet in there. But if the tablet's broken up into into powder, that's totally fine too. It is not going to affect how the efficacy, how it works. It's not going to change the way it feels going in. And it's fine either way. But you will typically see it as like a little capsule or a little tablet at the base of the vial.
Perfect. Thank you so much. Thank you for answering all these questions so far tonight. And one thing, we are all caught up with questions, and sometimes I know people think of questions based on another question they already heard or things like that. So we're definitely going to give you more time, and there will be time again at the end to make sure you can bring up any questions you may have. One thing, we'll give about another 30 seconds or so for people to answer or ask any questions they might have that they want you to answer, Laurel. But in the meantime, as we give them another 30 seconds, I'll throw it back over to you in case there's anything else you want to share before we get ready to move on to the next product and final product.
Okay. Yeah, sure. There is a little bit more I wanted to share about Menopur. I mentioned that it's a combination of FSH and LH. And those are both hormones that work in concert to stimulate the ovaries to mature the eggs. So they're both important. And because it has that FSH and it makes those follicles grow, you may feel like you have a couple of rocks that you're carrying around in your pelvis, one on each side of your, one on the left, one on the right. So if you feel like kind of this heaviness in your pelvis, that's very, very normal. Your ovaries are getting swollen and it's pulling on the ligament that holds the ovaries in place. So they're a little bit swollen, it's pulling on that ligament, and you're going to feel that heaviness there. Another side effect that I didn't mention is fatigue. Don't be surprised if you get super tired, okay? Fatigue and a little bit of moodiness too. So I think that's it for me with the Menopur. So when you're ready, Craig, you can go ahead and start the video on the Sonera patch.
Hi, my name is Laurel, and today I'm going to show you how to use the Sonera patch. The Sonera patch is used to numb the site before you give an injection. It can also be used for an IV start. It can be used for a lab draw. So whatever you need for, it numbs the skin. So what you're going to do is you're going to open up your package and pull out your patch. It's a combination of lidocaine and tetracaine. It is activated by heat, and it gets the medication into your skin using the heat. So what you're going to do is pull this back. The medication is in the middle, so you don't want to touch that part. You want to make sure that the place where you're putting the patch for your injection is clean and dry. And then you're going to place that right on the area where you want to give your shot. Make sure that you don't cover these holes because they do need to stay open to air to activate. And you're going to leave that patch on for 20 to 30 minutes prior to giving your shot. Once 20 to 30 minutes is done, you pull it off. You place your one-time use patch right on the cover, and you'll notice that it feels warm because once it's pulled off, that warmth activates it. And then you're ready to give your shot in that exact spot where you had your patch. And you probably won't even feel it. That's all there is to it.
All right. Any questions about the Sonera patch?
Absolutely. All right. So our first question is the Sonera patch only indicated for use before an injection, or can I use it for other purposes to prevent pain, such as blood draws, etc.?
As I mentioned in the video, yes, you can use it for blood draws or IV starts. It's perfectly fine for those as well. You just have to, time it right. So you have to know when you're going to get your blood draw, so you can put your patch on 20 to 30 minutes prior. So talk to your nurse. Let's say you want to use it in the morning of your egg retrieval, and they do have to start your IV. So ask your nurse what time she's going to be starting your IV, so you can put that patch on your arm. You also have to ask her where she's going to put your IV, so you can put it on ahead of time. But yeah, it's totally fine for any of those purposes, and it works great.
Great. Thank you so much. Okay, so you mentioned a little bit about the patch heating up when it starts to activate, and so I guess that kind of started this question that popped up. Somebody said, "So I've used it before. Is it normal for the patch to feel like it's starting to heat up quite a bit once I have it on my on the injection spot?" It says.
Yes, so it's activated by an iron powder, and the oxygen that when you open the package, the oxygen gets to the iron and it starts to heat it up. And that's what pushes that medication or helps it absorb into the upper layers of the skin. So you're going to feel that it's warm, and that's perfectly fine. That's what helps it absorb and helps it work so quickly. You know, the 20 to 30 minutes is a pretty quick, nice, convenient way of doing the numbing, and you don't feel it at all.
And so this actually is a good question that jumps off of your point about the 20 to 30 minutes. And we get this almost every single time. Just nowadays, people are just a little bit worried and want to make sure that they're using products correctly. And the question says, is it possible to leave the patch on for too long? Can that become dangerous?
That's a good question. So they've done studies at Sonera where they put several patches on at the same time, and they left them on for 20 to 30 minutes. They left them on for 60 minutes, and they didn't see any adverse effects. So they do recommend the 20 to 30 minutes, but if you leave it on a little long, it shouldn't be a problem at all. You might experience some side effects. The only side effects you might see would be like redness at the site, a little bit of swelling, or possibly a little bit of blanching or whiteness on your skin underneath the patch when you take it off. But once you take the patch off, it resolves very quickly.
Perfect. Sounds good. As of right now, it looks like we are all caught up on questions. This one, sometimes some stuff comes in that they trickle in as people think about them. So we will definitely give some time to think about it. But also, as this was our third product, we're also open if anybody does have any questions on any of the products. So feel free. But in the meantime, we are all caught up. So I did want to throw it back over to you, Laurel, just to if there's anything else you wanted to share with people before we start getting ready to wrap it up.
All right. Well, I just wanted to thank everyone for being here, taking your time to do this. I know that this is a difficult process, and I want you to feel more comfortable. Hopefully you feel more comfortable in giving your shots, and that's one step in the right direction. And I just want to remind everyone to just take this process one step at a time and keep the faith that you'll be building your family very soon. And I know you're gonna do great. My daughters.
Yeah, I figured as you were talking about building your family in no time, I wanted to bring back up again, just the picture so everyone can see. And that's really what it's all about. And that's what we're here trying to help everyone get comfortable with, so that you have the end game in mind. That's what we most importantly do not want, is for people to feel that you're just kind of focusing on the process instead of focusing on the end game of where you're trying to get to. And that's what we're all about here at PharmAssist, is really helping you become a pro so that you can get to where you want to get to and have that family. And that's the whole process. So thank you so much. I want to thank you, Laurel, for all of your time tonight, all of your great expertise, answering this question, for saying slow your roll. That was amazing. I want to thank you for that as well. I definitely want to thank everybody who joined us via Zoom and Facebook Live, and for sharing all of your excellent questions. We definitely hope that you were able to learn something tonight, and this is something that you can take back with you as you get ready for your process. If you're brand new to this, or if you're already underway and you just wanted to, learn a little bit more and get a little bit more comfortable, we hope we were able to bring that to you today. Don't forget, as Laurel had mentioned, all of these different videos, both the full virtual learning experience, or VLEs, as well as the individual product demonstration videos, all of those are available on demand on our YouTube page. You can find them on our Facebook page where you might be watching this right now, as well as at our homepage, which Laura, you mentioned. Thank you so much, on mymandelspharmacy.com/pharmacist. And you can watch all of those, queue them right up, right on a phone, and watch them right as you're about to give the shot. So it's a great way to really get yourself prepared and to be able to see, what you're about to get into. We look forward to seeing you again here next Monday night, as well as every Monday night at 7 p.m. Eastern Standard Time for another great program with another amazing nurse that can join us. And I do want to say, just as everyone probably knows, in the age of the internet, the number one way where this message gets out there is please, 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 if you know somebody, if it's a family member, if it's a friend, if it's a colleague that you think can benefit from these videos, please share it with them. Whether you share it on Facebook or you send them the link or you send them the Zoom link so they can join in to a program live. That's the way that all of this stuff gets out there. So we really, really want to say, if you thought this was good, please do us a favor and share that out there. And so other than that, we're throwing up real quick, there's just a little poll that pops up just asking for your feedback. But we do want to say again, Laurel, thank you so much for your time. Thanks for coming on and answering all those great questions, having props to be able to walk through some of this stuff. That was amazing. And I want to say to everybody, thank you so much for joining us, and we will see you again next Monday night. I am Craig Orapello. You are Laurel Meier, and we have had a great program on the PharmAssist virtual learning experience. Have a good one, everybody.
Stay safe.
Bye-bye.
Bye-bye.